This is day 2, and I will demonstrate how the mobility in his pelvis is normal now in all directions. But I thought I would just read what he reported. And he said that today he's sore, doesn't have kind of the same loose feeling as he did, right after we restored the movements. But the pudendal nerve symptoms are better. He has a good urinary stream and no perineal burning. He said that's really cool. And he can now lay on his back for the first time. And his brain is sort of looking for the symptoms, but it's not finding them. And he slept from 6 o'clock p.m. till 8 a.m. Slept very well.
That's amazing.
And you didn't have to sleep on the right side.
On
you
my
could
side,
sleep on either side.
Yeah. And
but
usually that's all I have to, like if I lay on my back or my left-hand side, the symptoms are much worse. I get the tingling and burning, and it's annoying. It keeps me awake. And,
yeah.
It feels kind of like I'm gonna lose it. So I have to sleep on the right-hand side of my left leg thrown over.
Okay.
To release that pain and or that irritation. And I didn't have to do that last night. I fell asleep on my back.
Yeah, nice.
That was neat.
Nice.
Yeah.
Do you have any sense of say standing differently?
Yeah, I feel like I don't know if it more even, I guess. I'm not favoring one way or the other.
Okay.
And then just that it's not like pain, but it was just kind of tight this morning when I got up. But
okay.
I did have that odd adjustment last night when I just rolled over with the covers and I had an adjustment in the low hip area back, and I went, I hope that was good.
Well, sounds like it was.
Yeah.
Sounds like it was.
So
so this treatment should last. It should be a one-time correction because your sacrum isn't made to go backwards.
Right. Yeah.
In day-to-day activities, no matter what your job is, it doesn't do that. So I will teach you how to treat it if this should ever recur. If you ever fall on your bum, this might present itself again. And you're in Maine and I'm in Colorado, so I like to teach people how they can self-manage. The assumption being if it's the same injury, you'll know if it isn't. But so today I like to teach gentle movement. I have video on YouTube. You use my last name, and then you search for basic and intermediate ball exercises, and I'll have you go through those. Okay. And I think those are very good for your hips, your SI, your pelvis, because your pelvis has movement, that is not the SI moving, and the low back as well. So, but what I think I'll do now is just show how the motion is normalized. And anything else?
No. So.
And, I think we'll know in time, did we take pressure off those sacral nerves? And if you look at the anatomy, you could make a case for them being overly tensioned, but also compressed where they come out of the neuroforamina. So, and when they go between the sacrotuberous and sacrospinous ligament, because now those ligaments have normal tone. So they could heal, and that could take time. I'm very interested in the 90-day report.
Me too. Yeah.
Good. All right, so lie on your back.
Okay.
Every night my wife yells at me and smacks me on the head and says, you have a bad business model.
Yeah, it's sending people away.
Not the repeat,
Teach them how to fix
the dependent
themselves.
deal.
Yeah. Oh, shoot.
And that's me. I went through medical disability, severe pain, and had to go on and develop my approach. And I've had some surgeries, which I needed. I had total knees. My knees were just trash. Line your stomach. So those things were a necessary part. But also, what's nice is that several things that I developed were effective in my recovery. Good. So that springs very nicely. So does this. And then if I go towards your feet, that has nice spring, as does that. And then midline on the sacrum, that now loads in spring. I see the force going down. I see your feet moving. And the sacrotuberous ligament is not as hard. I have to dig a little deeper to find it. There it is. And I indent it and it gives a little bit. So this is very encouraging. And of course, in response to that, as just like yesterday, I can't find the compensatory hyperextension up high. And then let's have you lie on your back. And I didn't have to do anything to your neck. It was driven completely reflexively. It's called the writing reflex. And it just was more than happy to release when we corrected the cause. And that's why my work is a whole body approach. And that's why I start in the feet, go all the way up to the jaw joint. Okay, so I contact here because I want to test mobility at the upper two joints. And I can load it, and I can spring it, and I can test it in extension as well. I had no movement yesterday, and now I can load it, and I can spring it. So all the neck work, all the upper cervical work would not have helped you. It required taking care of the source.
Okay.
Alrighty, well, thank you so much.
Thank you.
And then, yeah, please give me some feedback, be it a week or 2 weeks or, 12 weeks, whatever. Just kind of keep me in the loop if you don't mind.
Absolutely.
Thanks. Thank you very much.